I am Mavel Charlton Brown, Principal Hampton School, a boarding school situated in St. Elizabeth. We have a capacity of 1,200 young ladies, 264 of whom are facilitated in our boarding complex. The COVID-19 pandemic has impacted how we operate and how we cater to the students we serve. I am pleased to share with you some tips and tricks for the reopening of school in a boarding context. Tip 1. Reduce the number of students in the boarding facility. Hampton School has a student population of over 1,200 young ladies, and of that number, we accommodate 264 in our boarding facility. In response to the crisis, we have had to reduce that number further to 55 young ladies in the entire boarding facility. A facility that can accommodate 300 ladies with up to 14 young ladies per dorm, we have now 3 young ladies, a maximum of 4 young ladies in any one dormitory. This impacts how we schedule our students attending daily classes. As such, we have had to schedule very carefully 200 girls per day for classes, so that of that number, no more than 55 young ladies are in boarding. To effect that balance, we have had to strategize and to schedule specific grades for specific days or specific weeks. And we have asked teachers to ensure that when students are not engaged in a face-to-face context, they are engaged in the virtual space. Tip 2. Boarders must take their personal sanitization and protective items. It is now compulsory that each boarder takes her own mattress covers, vinyl or leathering, disinfectant sprays, hand sanitizers, and masks. Each girl is asked to use at least 2 masks per day, disposables or washables, and if their supplies run out, they are able to access those at our commissary. Tip 3. Revise visiting protocols. We have suspended vehicular traffic within the boarding complex. We ask our visitors or parents to comply with our temperature check protocols, and parents are not accommodated on the dorms. Tip 4. Redefine the roles of house mothers to ensure maximum safety compliance. House mothers routinely monitor physical distancing in the dormitories and in the dining area. And in conjunction with the resident nurse, they conduct temperature checks before breakfast and before supper each day. Tip 5. Enhance existing cleaning practices. Each day, after the young ladies leave their dormitories, the rooms are deep cleaned and industry-approved sanitization solutions are used to spray the floors and high-contact surface areas. Before the crisis, we offered laundry services to our young ladies. However, in order to ensure that all health and safety standards are met, we have had to suspend that provision. So our young ladies are now asked to do their own laundry. Tip 7. Revise dining protocols. Traditionally, our young ladies have their meals in a communal setting, using the knives, the plates, the forks we provide. But since the crisis, we have modified that approach and we use disposables for meals, all in an effort to optimize our adherence to the health and safety standards. Tip 8. Implement sanitization stations. At the entrance of each building, there's a hand wash station, and on each floor, on every dormitory, there is a hand sanitizer dispenser. Tip 9. Establish isolation rooms and extended waiting areas. We care about the health and wellness of our young ladies. And so we have established an extended waiting area to the wellness center and an isolation area.